Welcome to Networking Arizona with host Carol Blonder. You'll hear interviews with businesses located throughout the valley. Networking, it makes a difference. If I traded it all.
Welcome to the show, everyone. As all of you know, I tell everybody to talk to everyone within 3 feet of you. And that's exactly what we're doing here right on the radio with everyone. If you want to get yourself heard on Networking Arizona, just give me a call here at the station at 602-277-5369, and we're going to get you connected with me so you can get yourself heard on Networking Arizona, too. I'm going to go in with my first guest. They've been on the show with me a few times now, periodically. I have with me Dr. Sperling and Dr. Ma. They're the owners of Smile Innovations. Welcome to the show.
Thank you. It's good to be back.
Hi, how are you?
Okay, so let's talk a little bit, okay, because you've been here before. You got a lot of stuff going on. You got a new practice that's opening, so congratulations on that. I hear that you just got your license for something very important for people. Tell us a little bit about yourselves and what you do.
Well, this is Dr. Kent Sperling. Been practicing in Arizona since 2006. Before that, I was with the U.S. Air Force, and now we're going into private practice, opening a brand new practice in Mesa.
That's awesome. So it's going to be open in Mesa, and the other one is in Tempe, okay? And Dr. Ma, you tell a little bit about yourself, too.
Well, I started practicing in 2004, and right now we're currently doing a lot of cosmetic and implant dentistry, and with Dr. Sperling on board, he's going to be doing a lot of sedation and laser dentistry. So it's pretty awesome.
Thank you for that, Doctor. We need that.
Absolutely.
Now, here's what we're going to do. We're also going to open up the lines to the audience for everyone. There's a couple of things. If you're dealing with teeth issues, they're here. They can talk to you a little bit about them. And you can call in and get some free advice right here on Networking Arizona for your teeth. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. I would say that if you're having some issues, you might even need implants, right? Can I ask any question?
Yeah. Teeth are very, very important. Everyone needs to smile and eat. So that's one of the basics in life.
Yes, it is. It absolutely is. And so many people, Doctor, they don't go to the dentist. The number one reason is why?
It's fear for most people.
It's not even the money sometimes.
That's right.
Right. So it is fear. And you said that you have started doing sleep dentistry.
I wouldn't call it sleep dentistry.
What do you
be
call
clear
it?
About that. It
is
oral sedation. The reason we don't call it sleep dentistry is because the patient is not actually asleep. It is an altered state. The patient is totally relaxed. They're in control. They're aware of their surroundings, but it's an altered state of consciousness.
Well, they're real excited. They're also going to open up the lines to the audience for everyone to get entered in to win an in-home teeth whitening. That's a $500 value free to you guys out there or someone you know. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. They want to talk to you about your teeth because it is important to take care of them. And if you have a question, you can even call in and ask one. They'd love to talk to you. You can check them out on their website. It's Smile Innovation, just one.com, and their phone number to call, it's 480-612-6352. They've got now 2 Valley locations. One is in Tempe, and now the new one's going to be opening in October in Mesa.
That's right.
Okay, so let's talk a little bit about, the top 10 questions about teeth, okay? So sometimes we talked a little bit about fear, okay? Mm-hmm. That is the number one reason why. I think what we're worried about, Doctor, is that it hurts.
Sure. That is a common question. People ask, will it hurt? And I can honestly say no, it will not. The reason is we're going to use several methods to make it not hurt. One, we've already talked about, which is the oral sedation, where the patient is going to be in an altered state of consciousness, completely relaxed, and really not knowing on what's going on in the mouth or not caring. And also using local anesthetic, the numbing. So with that combination and our training, the results are fantastic. A lot of people are.
Dentistry has come around, completely. It's just so much new all of the time, correct?
Yes.
So let me find out some other things. When you say it doesn't hurt, look, you're going to give us pain medication for afterwards if there's any?
That's right.
So there's nobody should really be fearful of going to the dentist whatsoever really anymore.
That's right. The medication becomes before, during, and after.
Before, during, and after. Everybody should call in right now, right?
That's right.
No, really, you shouldn't put it off. It's really silly to do that. I think another thing that's really important, too, will somebody be left alone, during the treatment?
Never. And I would stress, too, that they're not going to be left alone at any point. From the first phone conversation with our receptionist throughout the entire treatment and afterward. We'll make sure that somebody is there with the patient, emotionally and physically, to bring them to the appointment, stay with the appointment, and they're never left alone during the sedation, and we always make sure that somebody is assigned to take care of them after the sedation.
Do you recommend the sedation for most of your patients, or do you, and come on right up to the, so it's closer to you, or you can pull it closer to you. Do you recommend the sedation, or are there different things? Do you talk to them, do a free consultation to find out what's really right for them? Some people don't have as much fear.
Sure. I would say any patient is a candidate for sedation, because it's not just fear that sedation takes care of. Sedation takes care of the person who needs a longer appointment but just doesn't want to feel like they're in the chair that long. And that's the great thing about sedation, is it makes a 3-4 hour appointment feel like 20 minutes.
Wow. That's an awesome reason to do it, too.
Yeah.
What about you, Doctor? Did you want to put in anything?
I think we also use lasers, so sometimes sedation will be probably the next level after we discuss their treatment plan. So we'll go thoroughly over their health history, and we'll figure out what the best treatment for the person would be. So everyone's different.
Our lines are open here, and everyone's getting entered in to win an in-home teeth whitening. That's a $500 value free to you. And boy, oh boy, what a great time to be doing that. You know, because the holidays will be coming up. Everybody wants to have beautiful white teeth, don't they?
That's right.
And so you get to have one in-home, and that's a $500 value free to you. You can also call in. You can ask questions if you like about your teeth. Our number here again is 602-277-5369, and toll free it's 1-866-536-1100. You're going to get entered in to win the teeth whitening whether you ask a question or not. But if you have one, they can give you some free advice right here. They've got 2 locations. One is in Tempe. The other one is the new one that's opening up in October. It's going to be in Mesa. You can check them out. It's smileinnovation.com, or you can call them and make an appointment. You do consultations with everyone.
Yes, we do.
So they do free consultations, and the number to call is 480-612-6352. Okay. What if they have a medical condition? Will they still be able to be sedated if they have a medical problem?
They can, and the sedation procedures are different depending upon the medical condition. But for the vast majority of patients, the sedation is by oral route, by taking a pill or a drink before and during. Depending upon the more complex health conditions, we can have an anesthesiologist on board that will help with that as well. So nobody is turned down.
So that's great, because you just mentioned something. You said it's the pill that they take. So this is not something, when you think of sedation, you know, people think that they're going to have to put a needle in their arm, but that's another thing they don't want to do, okay, or a needle in their hand, right?
Right.
So they don't have to have it done that way. This is simply through a pill that they would take that would put them in a sort of a, what did you call it? What's kind of the state?
It's an altered conscious sedation. So they're still awake, but they're just completely relaxed and really don't care what's going on.
Let's talk about some of the different procedures that you offer there that they would necessarily want. I mean, I think I'd come in for just a cavity. I'm getting sedated, okay? What else? What else would you do there? I mean, besides, let's talk about the implants, okay?
Sure. Implants are a great way to treat missing teeth. From a single missing tooth all the way up to a full denture. Even for somebody who's worn removable dentures for most of their life, they can have implants and a fixed denture in their mouth.
I love this question. Is it ever too late for somebody to be able to turn their teeth around and fix things?
Absolutely not. When you come to me, your condition is a starting point. It's never too late, so we can always work with you.
When do you know that you need to come to the dentist? And when they're seeing problems, what would you say if somebody's really waited a long time and it's really important that they come in? What are they going to see?
Things to look for are sensitivity, loose teeth, bad breath, bleeding in the gums is a very common one. Tenderness to chewing. Those are all things to look out for.
I'll tell you something, guys. You all know the people who have not been to the dentist in a long time. Don't put it off anymore. They want to help you. They've made it very simple. They have this sedation that you can get from them. They have 2 locations. One is in Tempe. The other one is going to be in Mesa, and we've got our lines open here for everyone who's calling in, and you're getting entered in to win an in-home teeth whitening. That's a $500 value free to you or someone you know. People love those. And also, you can call in. We're going to go to a break, and when we come back, you can ask a question if you want any question about your teeth. They'd love to answer for you. Our number here again is 602-277-5369. Toll free, it's 1-866-536-1100. Check them out on their website. It is smileinnovation.com. smileinnovation.com, and their phone number again, it's 480-612-6352. I say call in here, get entered in to win the teeth whitening, and also ask a question, 602-277-5369. So welcome back, everyone. We're talking with Dr. Sperling and Dr. Ma. They're the owners of Smile Innovations. They've got an office in Tempe and a new one that's opening up in Mesa that's coming up soon in October. And our lines are open here. We've got everyone getting entered in to win. All you callers are getting entered in to win a teeth whitening. That's a $500 value free to you or anyone you know that would like that. That's in-home. People love those. It's way different than anything you can buy in the store, right?
That's right.
That's right. And also, you're going to, our lines are open here too if you want to ask any questions. They'd love to answer your questions if you have any. You're going to get entered in to win the whitening no matter what. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Check them out. It's smileinnovation.com. Okay, so we were talking at the break, okay, and you said there's some things that you can do now for people that they don't even realize what you can do. Go ahead.
Well, they've come out with new technology where we can do denture repairs, orthodontic retainer repairs, or fabrications right in office. A lot of people come in with problems like that. We have to send off. It takes 2 days to 2 weeks to get the appliance back. But now we can have it done in a single day in office.
Well, a lot of these things are different now because it used to be that you would go in, it would take, you have to come in, you have to have a fitting, then you'd have to check and see what color it was going to be or whatever it would be, right?
Right.
Now, how long does it take?
Well, we can do crowns in an hour. So when you break your tooth, you can have your tooth right there and then, like, pretty fast.
Yeah. And what else?
We do bridges. We do implants same day.
Wow. So bridges can be done in one day?
Absolutely. The
Wow.
technology's evolved that much.
So let's talk a little bit about the money, okay? Because that's another reason why people don't go,
Sure.
is because of the money of it. So how do you work in your office? Do you have plans for people?
You have to call Marianne and Kim. They set up like financial plans for people. There's a lot of financial options where payments can be low. It's like $100 a month,
Wow.
depending on like what they need, and they'll fit it to your budget. So everything's a budget, right?
Right. Everything is a budget. I mean, when you talk to somebody and you do free consultations with people, they're going to come in. They haven't seen a dentist in a long time, so you know that you have a lot of things that you can do, and they can pick and choose what they want, what's more important to do first, right?
Yeah, it's a choice between the patient and the doctor and the team. So the team will help them see what they want, and then we will deliver it for them.
How about if they want the sedation? Are they going to think that's going to be quite a bit? How much is that to do?
Typically, it's $500 for the sedation, which is really affordable considering the time savings that you're having at work and the fact that you're getting your teeth done rather than putting it off and incurring more dental costs.
Right, and it's something that, a lot of people now are looking to have something like that done. So it's awesome that you're offering that. That's new that you're offering. Again, you can call them. They do free consultations. Their number is 480-612-6352. And also you can call in here. You can ask a question if you want. Our number here is 602-277-5369. And toll free, it's 1-866-536-1100. And they'll answer any question that you have about your teeth. You're all going to get entered in to win no matter what. That teeth whitening, it's an in-home whitening that you're going to get. It's a $500 value free to you. 602-277-5369. And toll free, it's 1-866-536-1100. So how long will the medication then last when they're doing all of this? Are they going to have to stay there for a long time? How long does it work?
The patient leaves the office as soon as the procedure's done, and they go home with their escort. The effects of the medication typically last until the next morning, but usually they've overcome it as far as their consciousness within about an hour or two.
Is it safe?
It's absolutely safe, and the reason it's safe is because we're monitoring very closely the exact effect that the medication is having, not only through visual and verbal interaction with the patient, but also with the vital sign monitoring, blood pressure, heart rate, all that.
So the person that comes into you who hasn't been to the dentist in a long time, and they might even need their teeth pulled, right?
Mm-hmm.
Let's talk about what happens when they come in the office and what you do with them. Okay, go ahead.
Okay, so if somebody comes in and let's say in a situation where they need all of their teeth pulled, we first have a consultation. We find out exactly what health issues are going on, what medications they're taking. There's social support network as well, because that plays a big role in how we handle, how we schedule. From then, we initiate the sedation at the next appointment, and we do the procedure, and they're released. And typically, the patient is released either with implants already placed or with a prosthetic in the mouth that they take home, but they never leave the office without something in the mouth to smile with and chew with.
Wow, that's awesome.
Unless they choose to, right? So
Unless they choose to, but most people don't choose that.
Right. Why would they choose not to?
Finances.
So again, it's mostly when it comes down to finances, but you've made that affordable. You've made things affordable, but also you've made it easy for people because you have in-house financing, which is awesome. And let's talk a little bit about some of the different procedures that you can do so they can hear some of that besides just this sedation that you're offering now. So let's talk if you want to go into some of the different procedures. Go ahead.
Sure, we do periodontal therapy, and one of the ways that we do it is a minimally invasive way through use of a laser. Typically with certain types of gum disease, the doctor would have to open up the gums and scrape the bone and scrape the roots of the teeth, which, just talking about it makes me feel uneasy.
Sure.
If I were a patient, but with the laser, that doesn't need to be done.
Right. So the laser is did you say non-invasive?
Non-invasive, minimally invasive. We're not peeling back the gums. We're just removing the diseased areas with the laser and cleaning the roots with the laser as well.
So that is when somebody has to have like a intense cleaning, correct?
That's right.
What else can you do laser now?
Okay, we can treat herpes lesions. We can treat tongue ties. We can do fillings with lasers with no anesthetics.
Wow.
There's a whole bunch of things.
So today, when somebody really if they're putting off doing their teeth, it's really almost a silly thing to say. But it's something, in other words, you just brought in their tongue ties, and we've talked about this before on the show, and I always bring that up when you say it. I can't believe it. But tell them what it is, and also tell them why it's important that they have that taken care of. Go ahead.
Well, for babies, they won't attach to their mothers, and for adults, they won't be able to speak properly, and even in the development of your jaw, so your face won't develop properly, so then you'll go into orthodontic treatment and all these other issues. But it's just recently found out that sometimes it could be attached to like other diseases like ADHD because you're not getting enough nutrition. So those are more studies that we have to follow up on, but those are just the latest news that I've seen.
What are the symptoms if they would know that they would need something like that done?
Well, if the baby doesn't attach to the mom and they're crying all the time, they're not going to get enough nutrition. And then it's psychologically damaging for the mom, too, because she thinks that there's something wrong with her.
Right.
When there's nothing wrong with her, it's just there's a little attachment. So
you can do that with an infant?
Yes, with an infant.
Really?
Yeah.
Wow.
So it has to be treated pretty soon. Because before they actually use a scalpel to do it. So I don't know how do they do it, Dr. Sperling? They just take a scalpel and they cut it off at the doctor's office.
That's right. That muscle attachment is cut with a scalpel.
Yeah, but you don't. You use it.
We use a laser, and there's minimal bleeding, and there's almost like no pain.
So for the adult, what would they be? What would their symptoms be if they need that done, and they never had it cut off when they were younger?
I've seen adults where they had no clue that they had a tongue tie. But one thing you can do is try to touch the roof of your mouth with your tongue. If you can't touch the roof of your mouth with your tongue, then you've got a tongue tie.
Wow. I'm always get tongue-tied, especially doing a radio show. That's really funny, though. But no, if you can't touch your tongue to the roof of your mouth, you probably should have that done.
That's right.
So, and again, they do it non-invasively with a laser, which is awesome. You can check them out on their website. It is smileinnovation.com. They've got 2 locations. One is in Tempe. The other new office that's opening in October is going to be in Mesa. You must be excited about that. Are you going to have a party there?
We will have a grand opening. Right now, we're waiting for our contractors to give us the exact date when we're going to be open because the city has to approve of all of their structures and the sedation and everything. But we're looking towards the beginning of October.
Now, their phone number to call, they do free consultations, is 480-612-6352. And I'm going to let everyone call throughout the rest of the show to get entered in to win the teeth whitening. And that's a $500 value free to you. Talk a little bit more about some of the different things you can do, Doc.
Besides the laser, like I said, we do implants, single implants all the way up through complete dentures with implants. We use the laser for the implant surgery as well, which makes it less invasive. Dr. Ma had mentioned doing fillings. We do fillings with the laser, numb the teeth with the laser. We can even do TMJ therapy, with a laser. A lot of people now are stressed out. They're grinding their teeth. They're having joint problems, muscle problems that can all be treated with what we call a cold laser.
So that's done non-invasively too. But do they get an actual brace for their mouth, or what happens?
Typically we do. Sometimes we adjust the bite on the teeth themselves, but usually it does require some sort of mouth splint that they can wear at night to help protect the enamel and settle those muscles down that are overactive.
Well, we've got our lines open here, and I'm going to let everyone call throughout the rest of the show to get the in-home teeth whitening. Everyone's going to get entered in to win that, and our number here is 602-277-5369. Toll free, it's 1-866-536-1100. That's a $500 value, free to you. What are your final words, Doc?
Final words are come and see us. There's no reason anymore to put your dentistry off.
There are 2 Valley locations. One is in Tempe. The new one's going to be in Mesa. You can check them out at smileinnovations.com. Innovation, it's only one innovation.com. And keep on calling here at 602-277-5369. Get this in-home teeth whitening. It's a $500 value, free to you. And look beautiful and have white teeth for the holidays.